Heart disease reversed, not just slowed, reversed. A landmark clinical trial proved it. That means measurable reduction of plaque inside the coronary arteries. This is the shift from probability to predictability. Let me show you how, beginning with a systematic cholesterol strategy that most treatment plans never fully implement. We use a three-tier approach to lowering LDL cholesterol. Each tier targets a different biological mechanism. And here's what most patients don't realize. Each step reduces from wherever you are now, not from where you started. If statins aren't tolerable, alternative medications still reach these targets. Here's what that looks like in practice. A patient starts with an LDL of 160. A high-intensity statin cuts that by at least 50% down to 80. We add ezetimibe, which blocks cholesterol absorption and reduces from the current value again, bringing LDL to roughly 64. Then an injectable medication called a PCSK9 inhibitor can reduce that even further, pushing LDL below 30. Three different mechanisms, each one compounding the effect of the last. Most treatment plans stop at step one, ours doesn't. But the question isn't just how low can we go, it's what happens when you actually get there. The ASTEROID trial followed 507 patients whose LDL was driven to 60.8. The result? Nearly 1% plaque regression in a disease that usually only goes in one direction. And it wasn't a handful of patients. Approximately 2/3 showed measurable reversal. In the rest, the plaque still changed, becoming more stable and less prone to rupture. That shift matters just as much. The GLAGOV trial took it further. Even greater reversal when a PCSK9 inhibitor was added to statin therapy. The lower LDL goes, the more plaque responds. Most guidelines target LDL below 70, some push to 55. We go further because below 60 is where reversal becomes most consistent. Is it dangerous to go that low? The FOURIER trial followed over 27,000 patients, no safety signal. But cholesterol is only part of the equation. There's a second process making the disease worse, and we treat that too. In the last video, we showed you inflammation measured at the molecular level, from the trigger inside the artery wall, through the signals that amplify it, to the C-reactive protein we measure in your blood. Targeting that cascade is no longer theoretical. Colchicine proved the concept. Two landmark trials, COLCOT and LODOCO-2, showed 23 to 31% reductions in major cardiovascular events, heart attacks, strokes, cardiovascular death, safe and effective even in patients in their 70s and 80s. But here's what sets our practice apart. When inflammation signals stay high despite the best available treatment, we don't accept that as background noise. We investigate why, because the cause determines the treatment. The science is advancing toward more targeted approaches to inflammation in the artery walls, and we stay at that frontier. Two pathways. One treatment philosophy that evolves with the evidence. The question patients always ask is, how long until we see results? We've seen plaque respond in as little as 6 months. Most landmark trials confirm measurable reversal at 12 to 24 months of sustained low LDL. But here's the key insight. It's not just how low you go, it's how long you stay there. Patients who reached LDL below 60 and held it there for 24 months saw the strongest response. And the benefit continues beyond that initial response. Plaques stabilize. This is what our precision monitoring shows you. Your LDL falling, your inflammation cooling, your plaque responding. Sometimes that's visible shrinkage. Sometimes it means the plaque stabilizes, becomes quieter and less dangerous. Either way, you see the biology shift. That's not hope, that's data. Medical treatment is the foundation. What you build on it determines how far reversal goes. That's not hope, that's data. You're not rolling dice anymore. you're watching measurable changes on a predictable timeline. In our next video, I'll show you how lifestyle amplifies what treatment has started and why that combination is what separates good outcomes from exceptional ones.